Thank you very much. And I'm so a little bit nervous because my English is poor. So, after I work for Ditan Hospital again, as you know, I used to be work for the National Center Division Treatment and Care and over 40 years, and then I come back my hospital, Beijing Ditan Hospital. So no as an opportunity to practice my English. So sorry, maybe I cannot speak the good English for us. So thank you and Hong Kong Health Bureau, and thank you very much. And Dr. Mark give a nice introduction. And I'm very happy to be here and to share with us about the China HIV treatment program. So, it's the first case of AIDS in China was reported in 1985. It's an American tourist. So at the very beginning, all of the HIV positive people is import cases. That means it's a foreigner. And the second stage is the very is a risk population, like IDU population and former plasma donor patient. But right now is a common population is infected HIV and AIDS through the sex activities. And in the end of the 2024, more than 100,000 people new report cases right now. And from these slides, and before 2019, and you report HIV in the case going up every year, but after COVID-19, and you can find the new report cases is going down. It's very good, and it's very good things. At the beginning, we think maybe it's the COVID-19 and in fact HIV testing, but right now we confirm after we scaling up HIV treatment and other the other things, and HIV new infection is going down. It's true. So just I mentioned before, and the HIV patient is changed a lot. Right now, over 97% in HIV patient is in fact HIV by the sex. And the blue bar you can find is hetero. And the red bar is the gay man population. The newborn baby, in fact, HIV is quite few. And for ITU population, in 20 years ago, it's common, but right now it's very few because Chinese government and is a methadone maintain program. That means all of the IDU population can get free methadone in the government methadone in clinic. So for IDU population, for the blood product, the almost stopped. But right now it's a sex, and a homo and a gay man is dominate for HIV. And my work is a treatment patient because I'm an infection disease specialist. I work for the infection disease and treatment care is over 20 years. And just like Dr. Ma introduced, from the 2004, my colleague and I, under the Chinese government, we initiated the National Free ART program. And that year, we do the pilot study in the small village in the Henan province in the Wenxi. It's Zhumadian. It's a small village, and all of the patients infect HIV through the blood. So, but in the small village, medical resources is very limited in how to manage. And the poor people and medical resources are very poor. And this is a big challenge. And because not only just a small population living, HIV patient living in the rural area, but at that time, and most of the HIV patients living in the poor rural area. We discussed with the WHO and UNAIDS many times, and WHO told me, and in those situations, we can do just the care, not treatment. But I told them, I'm a doctor, I'm not, so my work is to save patients' life. It's not only care. So we work with the government. Government make a decision. We treat the poor people in the medical resources limited the village. So in this pilot study, we recruit 100 poor people at the end of the AIDS, and we achieved successful. And the next year, we scaling up treatment in the whole province and other province. So in 2004, and the CD4 testing is available. As may all know, in the CD4 testing, virology and other lab testing is very important and for the treatment. It's at the beginning, the treatment criteria is quite low. It's a CD4 less 200, we treat them. The 2008, if CD4 less 350, and we can. But from the 2016, if the patient diagnoses HIV and AIDS, whatever the CD4 high or low, and we treat them, it's the same with the international criteria. So it's the first thing is we change our ART criteria. The second thing is the medication. You know, in before the 2002, and HIV antiretroviral medication is not available in China. So we only on a full generic the drug is AZT, D4T, DDI, and nevirapine. And then we work with a pharmaceutical company, and we got more and more an ARV drug and medication for the treatment. From the 2008, viral testing is available. So CD4 testing and viral testing and the antiretroviral medication is a basic in ART treatment. So currently, and we have several medication for treatment, and the first line treatment is D4T, 3TC, and efavirenz is the same with the WHO treatment recommendation. And the second line is AZT or TDF, 3TC or DTG or Kaletra. So you can compare the developed country like America and UK and the other developed country, and we have a small gap. And whatever the first line and the second line. So HIV treatment is not only the medical service, but also is a public health and service. So HIV control is a global challenge. The UNAIDS and the target goal is at the end of the AIDS. So is how to achieve the end of the AIDS. And the first important thing is to find the patient diagnosis. Then the target is 95%. The second is treat them. It's also the 95%. The three is a successful rate in the 95%. So if we achieved in the 95%, and we can stop the HIV transmission, because the undetectable AIDS means untransmission. So these slides show it's China right now for diagnosis, treatment, and treatment successful rate. So for the first challenge for China is how to find the HIV patient. So this is a big challenge. For the second goal is treat them. Treat them in China is okay because in China we have the powerful public health system, and the public health system can work with the hospital system very close. If the patient diagnosis, they can transfer to the hospital to treat them. So it's a treatment coverage is pretty good. And the last challenge is a successful rate. So because of the medication is limited in China. So this is a very big challenge for us. So first thing for the testing, government really pay attention for the HIV screen and the diagnosis. And from this slide, you can find every year we do the HIV testing very big. So it's every year and the HIV testing number is going up. Before, but the good news we can find the red line, and the new reported cases is going down. So but testing is going up, and the new report cases is going down. For although we try to find the patient, but the expert estimated a lot of patients still not to find, because in the first HIV diagnosis, the average CD4 is pretty low. And for example, in the first report diagnosis of HIV, the CD4 lies 200. It's over 30%. That means it's a latent discovery, right? So we testing a lot, but the first time and the diagnosis is still very late. So this is my work. My colleague and I work is to treat them. So we guarantee and treatment whatever for patient's family and for the society is very important. And we increasing the access to ART service is our duty. And right now it's over 96% HIV/AIDS people on ART treatment the end of the 2004. So the blue bar is a cumulative treatment. The right one is a new report, the patient's number. So I mentioned the medication, the CD4 testing and viral testing, but the ART treatment is a lifelong, right? So that means some patients should be occurred the HIV mutation. That means the treatment failure also, and then is HIV drug resistance. So, from the beginning, we pay attention for the drug resistance. From the 2003, the Chinese government set up the drug resistant the lab, and then we scaling up the lab to do the drug resistant and to support the treatment. But unfortunately, we can find the last one, and the drug resistance is still going up, especially for the NNRTI, like efavirenz and nevirapine and other medication. So after 20 years ART in China, right now, on treatment patient is over 1 million, 1.35 million patients on ART. So it's a big population, but China is a big country and a huge population. Right now we have 4,200 HIV treatment sites in the whole China. So in the how to management, and if we to do HIV treatment, we should be the patient, the virus, the medical and ability. So we find some patient treatment failure and drug resistant, and government right now is launch the 5-year HIV prevention and control plan. In this the government high quality national plan, we emphasize to improve HIV/AIDS treatment. So, how to improve HIV treatment and to insurance and to the treatment successful, and we can learn from the history from the other countries. And this is American study. You can find in the 1997, the treatment successful is very low, right? It's only 26%. But 2015 is 86%. And this study shows how to increase successful rate and the regimen. That means the using the better regimen, and is first the key important things. Other factors, including the male and elder people and the white people, is an influence and treatment successful rate. But in this study, we emphasize again, if you want to maintain or achieve the treatment successful rate high, we should be using the better regimen. This is the first key important things. The second thing, I want to share with us, the ART is a lifelong. It's not 1 year, 2 years, it's a lifelong. So to keep the patient in the treatment cohort is also same with the treatment, the regimen. So this is the German study, and this study it compare the different regimen is NNRTI based and protease inhibitor based and integrase inhibitor based. So right now in 3 categories, the regions regimen. So you can find in a different regimen and the treatment retention rate is a significant difference. it's just 2 years of treatment. A lot of people, HIV/AIDS people, receiving the ART, the dropout. And for example, for NRTI, its a treatment rate only 72. It's a keep the treatment the cohort. So, and if patient drop out, that means treatment failure, and they can the HIV and still so infect other people. So the second very important thing is keep the patient in the treatment cohort. It's the same with important with the treatment successful rate. So, and this is all study. My hospital, my hospital is a Beijing Ditan Hospital, located in the Beijing. And another hospital is a Beijing Youan Hospital. The last hospital is a Xixi Hospital in Hangzhou, southern of China. And with 3 HIV and hospital working together to do this study. And we include almost 30,000 HIV treatment patients. And this is a longitudinal study from the 2003 and the end of the 2023 is a 20 years longitudinal study. So this is like a mirror. It's like the China treatment, national treatment 20 years. And we can find the 3 stages. The first stage is like AZT and D4T. And the second stage is like a WHO recommendation. The second stage is like WHO recommendation. It's a TDF, 3TC, and efavirenz. So right now, it's a third stage. It's an integrase inhibitor based, like the DTG and the BSA. So in the 20 years, and we compare the different stage and different regimen, and we select the indicator. One is a treatment failure rate. The second is the treatment retention rate. We compare in the different stage and the different treatment, the different result. So first one, and we can find even in Beijing, the 2003, the treatment failure rate is over 15, it's 70%. But right now, it's going down. And it's right now, it's less 100, it's 1%. So that means 95% treatment successful rate we can achieve. But this is the CD4, and after treatment, and it's going up. But and the different medication is a big difference. So this is a priority of the viral load failure. So the right one is an integrase inhibitor, and the right one is TDF, 3TC, and efavirenz, and that one is other treatment regimen. So you can find we select the different medication regimen. The treatment failure is a big difference. So from the German and America and the China study, we we can find if we want to do the long-time treatment program, the two key issues. One is a treatment successful rate. The second, how the retention, the treatment retention rate. So also the same important things. So then right now, from the globally, the UNAIDS and the WHO emphasize, and after the treatment, immediately treat the patient. And 20 years ago, and we treat the patient, we waiting a long period, and 1 month to education patient. But right now, it's after diagnosis, we treat them immediately. So this is right now the China situation, and it's last 1 week, and the last 1 month is it's 1 month and 3 months. So we can find we still have some patient after diagnosis and receive the ARV is still late. So right now, this is also we should be improve the work. And so this is the 3 and 90% and the goal. I mentioned it before, and the first challenge is of the treatment, the diagnosis. The second is the treatment coverage. The last one is the successful rate. From this slide, and also find we still a gap to shift. And 2 years ago, we work with the German, is we can find in the German, and it's also to achieve the 95% in the target. I don't know if it's a UK situation, so and maybe later we can find the good news. So why we emphasize after the treatment and immediately it's initial the ART is okay, 15 minutes, okay. So because successful treatment in EU is undetectable and untransmission. So for the long-term successful rate, the undetectable and untransmission is a big challenge. It's just like the dream. So the other challenge and share with us is the system and the build up in it's medication, the lab. So it's the testing is for long-term treatment is very important. Not only we should be to do the CD4 testing, viral testing, and drug resistance and others. And right now, is the government pay for the HIV medication and the CD4 testing, viral testing, and the drug resistance. CD4 testing and viral 1 time per year, the government pay. If the treatment failure and the drug resistance testing, the central government pay. But from this slide, we find we have 4,200 HIV treatment sites, but for the lab capacity lab is quite few. So in future, we should be to improve or to set up the new lab and to support the long-term HIV treatment, and especially for drug-resistant testing. Drug-resistant testing is very important, but not enough. And the first thing for the technical thing, and the not all of the HIV mutation can testing from the first generation Sanger sequencing. And the second things, and not any time you can find drug resistance. The last things, and the drug resistant testing, they need the whole high quality the lab system. So because we need the testing the right time and the enough the quality life. So the drug resistant testing is still a big challenge. Now I think not only in China but also in the Asia and in the developed country. Before I used to be working in America a small time, and we can even in United States not is in time to do the HIV drug resistant testing. So this is a very interesting, just like this. And we can find small drug resistant people, but under the sea, a lot of HIV occurred drug resistant we cannot find, right? So it's like an iceberg, and we can find some, but under the sea it's more. So why the drug resistant testing and viral testing is very important? And this is another study. If patient occurred the drug resistance, the patient death rate increased 3.25 times. The second situation, viral testing over 1,000 and no drug resistant testing, the death rate increasing 3.65 times. If the viral testing and drug resistant testing not available, the death rate is over 60 times. So from this study, you can find viral testing and drug resistant testing is very, very important. So if Hong Kong and other countries want to do that big scale treatment program, that is basic lab testing. So I show you again, drug resistant occurred in the Chinese history. And I told before, we initiated the national treatment from 2002. And this study, the result is from 2004. And at the beginning, the drug resistance is quite low, but the recent year, and after we scaling up ART, the drug resistance, and it's going up very sharply. So this is a different regimen. It's a protease, like Kalischer treatment. This is a efavirenz. So we find the NNRTI, the efavirenz and niverpine is going up very sharply. And this is China, the different site. And it's Yunnan and Sichuan. And so you can find in the Xinjiang province and the province is pretty high. But in Beijing and Shanghai is lower. So it's a medical resources, the capacity building is very important for control the drug resistance. So, we mentioned many times and different medication occur is the drug resistance rate is different. So why the WHO and the developed country recommended and integrates inhibitor to do the first line or second line? Because the new medication integrase inhibitor is quite difficulty to occur the drug resistance. And this is I share with you and how to break the treatment failure and the drug resistance. So I think for the developing country, the medical resources limited, we should be to choose the high drug resistant barriers regimen because the patient is poor. That means the education is poor. So the adherence is poor. And the medical resources and capacity and the testing capacity is not enough. If the developing country, developing the site should be and select the high drug resistant regimen. So another the issue I want to share with you is how to management the treatment is dropout. So the ISI and ART is not only the individual medical service, it's a public health. We should manage everyone, at least most of the patients, we should be manage them. So globally, as many or some patient is after treatment is drop out, and how to find those patients and occurring those patients to treatment again. So this is a dropout rate in the some site. So for example, in the Guizhou province, the lowest follow-up rate is 9.26. And Yunnan is only around 6. But in the Sichuan province, you can find 80% the dropout rate. So dropout is a very important indicator to evaluate your program. So it's not enough time to share, but I want to emphasize again and again to keep the patient in the treatment, the cohort. So if the patient, dropout patient, return hospital to receive the ART again, we should be testing drug resistance and then to provide the high drug resistance barrier in the regimen to treat them, not using the before regimen. So, this is my last slide. I know it's a time is almost done right now. And in China, we conduct a very big the ART, national ART program. And right now, from the zero, but right now is over 1.35 million patients on ART. And the second thing, the China ART coverage is pretty high. And most of the patients achieve the treatment successful rate. But we still have a big challenge and approve our regimen and approve our drug resistant testing and to the patient's adherence and the other challenge for us because ART is a lifelong. So it's not 1 year, not 10 years. So it's a big system work. Thank you very much.